very special guest, our District Attorney Summer Steffen, who is obviously going to have some important information to share with us. Summer's leadership during this time has been critical as she and her staff have worked on a number of measures related to the coronavirus. They're working to prevent price gougers and scammers from taking advantage of this crisis to rip off San Diegans. They are also raising awareness of the many resources that are available to the citizens of San Diego County who may be at risk of domestic violence and are now facing even higher risks because of the stay-at-home order. Summer will give us an update on what the District Attorney's Office is doing, and we're very happy to have her with us here today. After Summer, we'll have Supervisor Fletcher give us an update on the informational charts that we've been sharing, and then we'll have a medical update from Dr. Wilma Wooten, our Chief Medical Officer. With that, our Public Health Director. With that, we'll go ahead and start with our District Attorney, Summer Steffen.
Thank you, Chairman. Good afternoon. Thank you, Chairman Cox, Supervisor Fletcher, and CAO Helen Robbins-Meyer for this opportunity to update the public about coronavirus-related efforts at the District Attorney's Office. First thing is to make sure the public knows that our 1,000 employees are on duty, and we've been able to adjust and adapt so that we can continue to serve victims of crime and to safeguard communities. While this crisis has brought us together and stronger than ever, it also has provided an opportunity for greedy people and those who want to take advantage of vulnerabilities based on fear. We see more charity scams. We see fake cures for the coronavirus being exploited. And we also are very, very concerned about the trend that we're expecting based on past experience, and that's having people take advantage of the economic impact payments that are coming to our community that many are looking forward to, and unemployment checks also. Because of these scams, here are some very important prevention tips. Don't email back any organization that claims to be a charity before you check the Attorney General's Charities tab to see if it's legitimate, and then go on the official charity's website rather than click that button because it may be a phishing scam. Also, don't believe anyone that tells you that they have a cure. Check with your medical professional and listen to the amazing doctors, Dr. Wooten, Dr. Nick, and Dr. McDonald at the county, and what they are advising you about. Again, also, it's really important that you understand that IRS or any legitimate government entity will not be calling you and asking you for your personal private information before they send you a check. That's not going to happen. So if in doubt, call the official person or government before you do anything else. I want to be very clear that we will not tolerate people taking advantage of our consumers through price gouging. And as you know, San Diego's efforts has been noted twice by the governor for the proactive approach to helping our consumers. Our office and our tip line has fielded over 240 tips of different claims of price gouging, and we've served notice to cease and desist on 24 businesses, most of whom immediately complied. We looked at everything from masks being charged 3 and 4 times the price to milk, water, eggs, and toilet paper, and we take those seriously. The price gouging statute has some loopholes, and yesterday Governor Newsom took action to close some of those loopholes, especially as to new companies popping up under a different name online. And we're going to be using this new executive order to bring more accountability in San Diego. Also, while the wisdom of the stay-at-home orders is clear and imperative, it is also a reality that home is not safe for everyone. So we are expecting from past experience and anecdotally seeing examples of domestic violence on the rise. Because of additional contact, the stressors of economic, losing a job, or having the children at home, children can be caught in the crossfire and don't have safe counselors to go to. We want victims to know that there is a lifeline for them and that they can reach out for help and that there is real help. We've compiled a whole resource page that's on our website, sandiegoda.com, that explains every resource, including what shelter availability, food, diapers, other resources that may be available. So please, any person who knows a victim or is a victim out there, just because you are physically isolated, we're just a phone call away. This is not business as usual, but we are running the business of the day and protecting our victims. Another area that we're coordinating is with our courts. Now, I want to thank the leadership of our court, the presiding judge, Lorna Oxney, assistant presiding judge, Judge Smith, and the criminal presiding judge, Judge Arabidi, for their tireless efforts. Even though the court's front has been closed, the work has been going on with the court 24/7 in order to make sure that there is access to justice balanced with the real reality of this pandemic. The courts will open in terms of virtual remote hearings next week, and we are working to convert and to leverage our technology in order to conduct these hearings safely and make sure that we don't get releases for some major murder and sex crime cases that we have. We're going to assure the public that we're on duty doing that. As you know, the transport of prisoners is a real threat, and with this remote technology that the sheriff has implemented in every jail, we're going to be able to run the criminal justice system well and with access to justice and fairness to everybody and health to everybody. We're also working on some important initiatives to make sure that there is room in the jail for the violent predators that should not be released while allowing proper social distancing and the ability to quarantine. And the sheriff has taken on measures on his own, but there are certain measures that require the district attorney and the courts to sign off. And that is happening and allowing for that safety within the jail. The public safety is and will always be our priority, and I'm proud of my team that is working on fulfilling that responsibility. Thank you.
Thank you. I want to thank our district attorney. I know the people of San Diego appreciate your vigilance, your aggressive posture in moving forward, and sending a clear message to those that would try to exploit a time of crisis and vulnerability for financial gain or scam, that you will face the full force of the law and our district attorney. And in San Diego County, we're grateful to have her on board and aggressively enforcing these measures. Every day we talk about the important role of flattening the curve. We do this to ensure our healthcare system is a viable option and is in place to meet those who might experience coronavirus and need the help of the medical system. But it is important to note that if you have serious health issues unrelated to coronavirus, and they are serious in nature, that our hospitals remain open. And it is okay to go if you are experiencing a serious complication or challenge or a medical situation that you do not believe you can endure through on your own. Our hospital systems do remain open, and they are available and ready to treat you. Part of the aggressive nature of what we've taken in stopping elective procedures and creating capacity in our system has shown itself to be preparing us well for what is ahead. But it is important that our health system and your health can be attended to, and you know that those resources are available if you need. So much of the efforts that we've talked about, we put in place broad-based things, shutting down non-essential businesses, requiring certain actions be taken. But at the end of the day, our success as a region is in large part dependent upon every individual San Diegan making an individual commitment to do their part. not just to protect themselves, but to protect others. And it is going to take each and every one of us, particularly in this vitally important month of April, to pledge, to commit, to publicly state and show that we are adhering to the orders in an effort to protect those that we love and care for. And that's why today we're launching a social media campaign to promote and encourage folks to make that pledge publicly, to take a commitment to stay home. Today, if you go to coronavirus-sd.com/pledge, you can see a simple pledge that each and every one of us can take, where you commit to pledge to stay home to save lives, to use a face covering and physical distancing when you leave your house for essential regions, and you pledge to help stop the spread. We are asking San Diegans to go to this website, to take this pledge, and then you'll have a variety of options to share this on social media, along with some Facebook frames and other types of material that you can download. And we believe there's an opportunity for each and every one of us to make a commitment to one another and to San Diego that we will be doing our part. Our first responders, our public health workers, our vulnerable citizens need every San Diegan to fully embrace and fully commit to the actions and efforts that we're taking. If you take it that the average individual person infects 3 other people, that one person who chooses not to do what we've asked them to do turns into 9, 9 turns into 27, 27 into 81, 81 to 243, and so the math around exponential growth continues to grow, and that's just with a single individual person who decided not to adhere to the actions that we've given. And so we're encouraging all of you to go to the website, coronavirus-sd.com/pledge, take the pledge, add a frame to your Facebook profile, share it on social media, email it to your friends and family, and let's see how many San Diegans we can get to publicly make a pledge and commitment to protect one another. With that, we will head into our daily report here for our slides. Today we are reporting 97 new positive cases to bring us a total of 1,209. Our test, as happens on weekends, is a little lower, 1,025, but we are almost at 17,000 tests countywide. And again, the day-to-day numbers are less important than the broader trajectory, which you can see on this slide, where you can see the testing capacity of San Diego County continues to increase significantly, and we expect this trend to continue in the weeks ahead as more testing capacity is brought online, as there's more options, and more of our health partners continue to do incredible work securing testing for San Diego County. Here you can see the number of positives relative to hospitalizations, ICUs, and deaths. Again, this is just a reminder that the actions that we take now as we continue to see an increase in positive cases can have a very positive impact on our region. And in particular, we've given some very clear guidance around seniors and those who are vulnerable, those with underlying respiratory and health conditions, to ensure that those individuals remain quarantined. Those are the folks who are most likely to need hospitalization and ICU, and those are the folks we most want to protect in our efforts. Pretty significant jump in the number of personal protective equipment. Over 200,000 additional items of personal protective equipment have been distributed to our healthcare system partners in the last 24 hours alone, bringing us to more than 1.5 million individual items of personal protective equipment that have been distributed. Our efforts there continue. On our motel rooms, we see an uptick in the utilization of our public health motel rooms, along with an uptick in the utilization of the regional task force on the homeless rooms, and we expect that to continue as well. And then no real change yesterday to today in the number of ventilators available. Again, this is just a daily reminder to us of one of our highest priorities and highest focuses, and we are incredibly grateful to our hospital partners for their collaboration, their coordination, the sharing of information, the way that everyone has come together to work together, and we will continue to fight to make sure that we have as much ventilator capacity as possible. With that, I will turn it over to Dr. Wilma Wooten for our Public Health Officer's update.
Thank you, Supervisor Fletcher, and good afternoon, everyone, and welcome again to our daily COVID-19 briefing. Regarding the global, national, state, and local statistics, globally, today there are 1,170,159 positive cases, which includes approximately 63,832 deaths. Nationwide, we have 300,915 positive cases, including 8,162 deaths. Statewide, there are 12,603 positive cases, which include 282 deaths. And today, the County of San Diego is reporting 1,209 cases, which includes 19 deaths. We would like to express our sincere condolences to those families, again, who have lost individuals due to COVID-19 during this pandemic. The one new death today that we are announcing is a male in their early 70s. Now, of the 1,209 cases, this is 97 more cases than we reported yesterday. Of this total, 672, or approximately 56%, are between the ages of 20 to 49 years of age. 570, or 47%, are female, 630, or 52%, are male, and 9, or approximately 1%, have no gender identified. 228, or 19%, of the cases have been hospitalized, and 89, or approximately 7%, of the total number of cases have been admitted to the ICU. Just as a reminder, the ICU cases are included or a part of those individuals that have been hospitalized. Lastly, the 18 deaths represent 1.5% of the total number of cases reported today. Again, our sympathies continue to go out to the families and the friends who have lost loved ones, again, to COVID-19. Regarding outbreaks in congregate and community settings, we are reporting 3 new outbreaks for a total of 16 cumulative confirmed outbreaks. 2 outbreaks are in congregate facilities for a total of 10, and we have 1 new community setting outbreak for a total of 6. In both situations, individuals are on isolation at home and not hospitalized. Lastly, as a reminder, when individuals go to the hospital, either by ambulance or by self-transport, our hospital partners are asking us to remind you to please bring your medications, especially inhalers, with you to the hospital. Once again, thank you to all of the individuals, organizations, businesses, governments, and other entities for all that you are doing to help stay at home unless you are essential, stop the spread, and save lives. This is a very important time that we are in, and we thank everyone that's helping to do what's needed to help save lives. Now I'd like to welcome back to the podium Supervisor Cox.
Thank you, Dr. Wooten. We're going to go directly to the questions. I believe we only have 1 call-in question, and then we'll get to the text questions. And again, if we don't introduce you by name and outlet in the introduction, please make sure you do that.
Union Tribune, please state your name and question.
Jennifer Vangrove, San Diego Union Tribune. I just wanted to see if the county had any insight into some of the partnerships that were announced by the state today. UC San Diego, for instance, was referenced as far as testing capacity. Is there any additional information the county can provide on those efforts? Does that mean there's going to be more testing hubs in San Diego, more tests available to San Diegans, et cetera?
Yeah, could you repeat that question again? We're trying to get to the gist of the question. Do you have enough to go on?
I'll just
Okay.
try to respond. Good afternoon, Dr. Nikki Fantides. I think the question had to do with regard to new announcements. Are you back on the line? Did you want to re-ask your question, please?
Sure. My question was, Governor Newsom announced partnerships at the state level with UC San Diego and UC Davis related to testing throughput, testing capacity. I was just curious if the county could provide additional clarity on what that means at a local level. So is there going to be more tests available to San Diegans? If so, how do they get access to those tests? And then also, I wanted to see if there could be clarification on the numbers of deaths and positives. They seem to be a day behind. Thank you.
I will let Dr. Wooten confirm the issue with regard to the dates and positives, but I will respond to the question in terms of the testing. I only heard in general terms the announcement that was made at the state level in collaboration between UC Davis, UC San Diego, and some additional resources. UC San Diego, for here locally, is totally involved in the collaborative efforts that we are all a part of, as is Rady Children's and every major health system. We absolutely expect that there will be an enhanced capacity for local testing in terms of what that translates to with regard to number of tests and so forth. I cannot give you a figure, but what I can tell you is through the collaborative, public, private, university partnerships, any testing capacity in our region that will be enhanced, especially with UCSD, will be to everybody's benefits. And Dr. Wooten, if you could confirm the numbers, please. Thank you.
So let me go back. Just again, we have 1,209 total cases. I'm going back a little further upstream. That's 97 more cases than yesterday. Yesterday we had 17 deaths. Today we have 18 deaths. So I just want to make sure that everyone gets those numbers right. And in terms of testing, just before the governor's press conference today, it was known that San Diego has conducted more testing throughout the state than any other county. We have 3 kind of buckets of where tests are being performed. At our public health laboratory, through hospital settings, and we've had, through the middle of the week, 7 locations, with several more coming on. And then we have our commercial laboratories. That includes LabCorp, Quest, BioReference, and Mayo. So the latter 2 are newer commercial laboratories that have come on board. What I believe the governor talked about today were certain entities like UCSD increasing the number of hubs throughout the county where additional testing is going on. So UCSD is already testing, but it looks like they might be doing more testing throughout the county. So that's what we know. Again, San Diego is performing more tests than any other public health jurisdiction within California, and obviously, based on the report today, we will be conducting more. And even at the county level, for our public health laboratory, we will be ultimately bringing on the Hologic genomics instrument. It is on order, and once we have that capacity, we can also conduct thousands of tests a day, just as Rady's now already has that capacity. So San Diego has a significant capacity and will be increasing its capacity.
I'm getting a couple more texts about the number. Do you mind going through one more time?
Yes.
The number of fatalities today?
18 is the number. It is 1 more than we had yesterday. And the death is in an individual, male, who is in their early 70s.
Okay, great. And then I have another one from Jane Morton, CBS. If a dog's owner has the virus and pets their dog, can the dog carry COVID-19 and spread it to others who may pet that same dog?
Well, there's been a lot of information or discussion about that just today. I saw a study that was conducted in Wuhan, China, again, based on a small number of cases where individuals that were positive for COVID-19 had cats, and the cats then tested positive for COVID-19. And then there were also cats from pet stores as well as on the streets. And 9 in each of those latter categories also tested positive. What does this mean? We're not 100% sure. Did the owner give it to their pets, or did the pets give it to their owner? We're not sure. But CDC is recommending, not because there is substantial evidence about transmission between humans and dogs, that if an individual is positive for COVID-19, that they separate themselves not only from their family members, but also from their pets. So that's the guidance that we are giving today. As more research is conducted in those areas, we'll have more information to share.
And a question from Shonda Walker from CBS. We're hearing a Walmart employee on East Lake tested positive for the virus. Can you confirm?
Well, as we've stated yesterday, we do not give out details such as that has been requested. When a business or an organization has a positive test and we've determined that the individual that's positive works in a company or a business, we send that business a letter, and then that letter is that business is responsible for communicating with their employees. So again, we will not give out the names of businesses.
And Dr. Wooten, this is from Melissa Sandoval from NBC7. She is asking, are there any cases of pregnant women with coronavirus, and if so, how many?
I don't have that information.
Okay, I believe that completes the questions for today. I know that we've talked a lot about facial coverings lately, but it's important to remember that other steps that we've emphasized are equally important, and that includes washing your hands, practicing physical or social distancing. We've done a better job of that recently, I think. In fact, a national firm recently analyzed data county by county and gave San Diego an A- on social distancing. Now, that's a pretty decent grade, but I know San Diego, we can do better than that. A top federal official also recently praised California for implementing social distancing strategies early on and said our efforts are paying off in slowing the spread of the virus. That's great news, but I say all this not so that we can slack off, but to say we are doing what appears to be working, and I encourage all of us to do even more of it. We want to beat this virus and flatten the curve much sooner, and we can do that if we get people to, again, stay at home, wash your hands, and maintain that social distancing and covering your face when you're outside of your home. And speaking of covering your face, I want to share some good news, as we like to do from time to time. And there's a lot of good news out there in spite of the coronavirus. We're doing all we can to address the issue of personal protective equipment or gear for nurses, doctors, and emergency responders, and we're looking near and far for all the personal protective equipment that we possibly can. Well, thanks to past efforts of local leaders, and specifically I want to call out former Supervisor Ron Roberts, who was instrumental in helping the county develop a government-to-government relationship with the city of Yanqing in China. We've been working with the mayor of Yanqing, and he is in the process of sending 20,000 surgical masks to assist us in our response. I want to thank the mayor of Yanqing and our local leaders, particularly Richard Ledford, who has been very helpful in this, who helped make those arrangements. I'll keep you updated and posted about this effort, and hopefully we'll receive those masks within the next few days. And remember, when you leave your place, cover your face. We'll be back here tomorrow at 2:30. Thank you.